8 hours would do it. Maybe we're wrong, but y'all have asked to discuss this, so we're doing that. And if it's the amount of time that's the sticking point, then we'd certainly consider a lower amount of PTO if that's council's pleasure.
Well, and as I mentioned to you when we talked on the phone about this, I would have a hard time voting yes for this, but I recognize that I believe this is under your purview. And so I supported you in making the decision that you felt was best in alignment with the information you were getting, because you're getting exposed to a lot of information I was not and still have not been. And so that's where I still am. I support your authority and being able to make this decision. I still don't know that I could vote for it because of issues that I have, and I wasn't intending to go into a whole bunch of things today, but that's the bottom line for me.
And this is a larger conversation, and I will concur in regards to the sentiments articulated by Councilman Price. This budget that we have right now, if you look at the hundreds of millions of dollars we're entrusting you, the CEO, with, I also would provide my support for you for things that you are thinking about, your association, your peers, in regards to mitigating loss of work. If someone is COVID-19 positive with the CDC guidelines, they're missing work anyway. In fact, I would argue that may extend beyond just a regular vacation. And so we're trying to have just a proactive conversation of what things we can do. I mean, everyone's trying to give their best guess. We don't know. I mean, who knew 2 years ago we'd be in a global pandemic? And this is my 1 year anniversary from being COVID positive. And so you do a great job, CEO. I'm supportive. I was supportive of you in that decision. You don't always make the right decisions, but most of the time you do it well. It comes to a point we're not satisfied, then we can do something from that standpoint. But I appreciate the thought process that went into it, and I also appreciate voices on the council providing input and guidance to a conversation that is healthy for the council and for our community.
Well, I don't feel unsupported by the council. I think that the charter is very clear. All government authority stems from the council. And so if the council wants to discuss something, it is your purview to do it. I don't take it personally. It's how the process works.
Well, I want to make one thing clear is I'm behind our city manager 100%.
No, you are.
Okay? I just don't like this proposal.
I understand that well and clearly. I appreciate your support.
And yeah, I'm not trying to punt our responsibility. I will stand behind the decision because I'm going to go with what Councilman Price said. Yeah, this is your full-time job and you have way more information to your, the facts. You have more facts. I mean, we can get them, but you have more facts at you at this point. My concern is if we can make it, and I hate to use the word fair because, fair is what is out at the Expo Center. Equitable, I guess, is perhaps a better word. If we can make it equitable. If we can't, and you feel like this is the best path, then I'm behind you 100% on that one.
Well, I will say that based off the council discussion right now, it seems like we have a divided council on this issue. I was born, but not yesterday. And I'm not going to institute a program that was called for by a councilman to be discussed if it doesn't have council backing on it. And I think I would like to revisit this issue again with the council. Maybe we give it a week or two for people to continue to think about things and ask questions if they'd like, receive input from the community. But I do believe it's important to get our workforce vaccinated. I do not think you can shame them into doing it, nor should you. I don't think you can compel them to do it by force, nor should you. The only other option is education and incentives. And so we can strictly keep an education model. I had one employee who was exercising their right to speak, and they said, look, if you're going to say this about pro-vaccination, I should be able to say this about not getting vaccinated. And I simply told that person that It's in with the course and scope of my employment as city manager to do things and send messages that are for the good order and discipline of the organization, and that's what I did under this deal. So there are good people that differ about whether vaccines are good or bad. I'm not trying to weigh into that. I'm just trying to get the organization prepared for what is going to be more than likely another COVID hit for this community, and I want to have a workforce that can provide services to this community. That was the intent of it, and I appreciate council's dialogue.
Well, and I'll say, and this is an example of a healthy council,
Absolutely.
where you have a chance to have a conversation that's important. I mean, those who went to the ballot box and voted for us, representing this community. And I think the views as council consistent with the community. From my standpoint, I'm not supportive of any sort of mandated vaccine. But if you, Annette, those who are in charge of looking for the health and well-being of this community within the district and your purview of employees, and we can do things that will allow us to create an opportunity for Abilene to be at the state and national level for vaccines. I think science says less people get sick, less people die. And I think I'm in favor of things that we can do that will encourage that and make it even easier. You know, we talked about maybe even reaching out to churches and other nonprofits. And so I would love conversation in that regards on how we can provide an opportunity to make it more accessible for those communities who choose to be inoculated. Any more comments from council before the public hearing?
Mr. Hanna, I just want to say I appreciate the fact that you've been proactive on this. It's not easy to step into something so controversial, but you did so, and I appreciate that. My only issue with it is I know it, and I know you well enough and know our city staff well enough to know they would never intentionally create disparity. But to be quite frank, my only issue with it is the disparity that it creates from people that have already taken the initiative to get the vaccine versus those we're incentivizing. If there's a way we can solve that problem, I think it's okay to incentivize. It's okay to incentivize vaccines. We have a different set of considerations, in my opinion. It's one thing, if in my business, for example, if I don't want our people to get sick, I care about them very much, but it's an entirely different animal if a firehouse is now taken out of operation, because of this. And so doing nothing to me is not an option, period. We have to do the best we can do with the information we have at the time. I'm interested to know how we rank, or I know rank's probably not the right term, but how we compare as an organization to some of the other large organizations in town in terms of vaccination rate. I know, you hear all kinds of numbers about what organizations have what percentage of vaccination rates and which ones don't, and it's hard to know what's reliable. If there's a way to get any version of reliable data on that.
There's not. We don't track it at all. So
right. We're extrapolating on ours, right,
correct.
At the 38.8, but I don't know if any of the other large organizations track that information. And so I'm in favor of doing something, not nothing, but I think we need to be very cautious about not unintentionally creating a situation where we're treating some employees differently than others. I don't think that's a good idea. And I know that's not your intent. I get that.
It's not.
But even if we hybridize the system somehow, or we can award a little bit, I think 40 hours is too much. Frankly, I think that's way too much time. That's a full week, and I know that number's the only one I've seen, but frankly, I think that's a lot of time. That's a full week of lost productivity. And so a shorter amount of time off or some equivalent monies, I'm willing to entertain those discussions. But I appreciate the fact that you're trying to do something here based on limited information. That's a moving target all the time, and we're trying to do something. And that, to me, that's doing nothing's not an option here. So I think we need to continue this discussion.
So perhaps the way forward is we'll put together a program, because it seems to be a fairly consistent conversation from some council members that this concept of we need to do something for those who've already received the vaccine too. I hear council. If we put together a program that does that and provides maybe some additional incentive mechanisms other than PTO or a lesser amount of PTO, we'll bring that forward to council in a resolution and have y'all take a formal vote on it. Everyone's conscience can then be fully exercised on the issue. and I'll have the direction I need to move forward.
You know, Annette, you mentioned something about that some places are and Mr. Hanna, maybe you too, you know, with health insurance premiums. Do we offer incentives within our health program for like wellness benefits and things
so
like
Hendrick Medical Center has a wellness program, and if you meet certain criteria, for example, your blood pressure is X or your waist circumference is X, and you know you have these different you don't have these comorbidity results, you can get a reduction on your health insurance. And so what they did with the COVID vaccine is they said if you get the vaccine, you get 50% of that point matrix, 50% is achieved. So if you had to get a score of 4, you got 2 points already, and then you say you had your blood pressure under control and you had a waist, if you're a male, under 40 inches, you get a reduction in your health insurance, whatever that actual reduction was. We don't have a wellness program like that set up. Frankly, we couldn't support it or fund it at the current rates of our self-insurance fund. But we're at a point with the fund balance, we may be able to consider some of that stuff.
Okay.
Maybe next year or the year after next. We wouldn't do it this year still.
Well, and you know, something you mentioned that, you know, COVID is going to be here for a while. And
It's
so
not going
maybe
away.
that's, you know, as we go down this road, you know, we can add that in there. So, okay, I appreciate it. Thank you.
Yeah, that's a good question. Thanks, sir.
This does call for a public hearing. Any other comments from council prior to that? At this time, I will open up the public hearing. Is there anyone that would like to speak either for or against this item? If so, please come forward and give your name for the record. I think we have a card.
From David Swart, Mayor.
We'll have a 3-minute time limit.
Thank you, Council. Once again, David Swart. If you see Dr. Fauci on the national news, he's treating it more like flu. He's pretty much saying, oh, you're going to have to get a shot every year. You know, you see the guy that's in charge of the UK over all them, he first spoke 60% of hospitalizations were inoculated, and he changed it, said only 40%. So that, you know, there's a big firestorm one way or another. The VA announced yesterday, well, you're going to have to get a shot if you're going to work for the VA. You know, back generations, several generations ago, we went to war for countries for doing stuff like that, imposing things on people. You know, it's, you know, the social media firestorm, when they put it on the social media on the TV stations, how many people screamed in and said, don't use city dollars. And of course, yesterday's media interview said, oh, we're going to use, we didn't say CARES Act, it said the rescue plan is what they call it now. But in the end, it really goes down to personal choice. It's not a bribe. But there was, in the packet, I did read that, there were several listings of different states and stuff of what they're doing to try to incentive employees. And one that caught me was Guam. That's an American territory. It's at a Pacific atoll. They said that 6 people would be eligible for a free car if they got their inoculation. You know, it's only 212 square miles on Guam. Would that really be a good incentive? I guess if you were just there temporary and you ship the car back to the mainland, maybe that'd be good. But in the end, it all goes down to personal choice, you know. People, there's so much misinformation. One